Hello, I am Suubi Esther Deborah. I'm 23 years old. I am a self-advocate as well as a peer educator at Triumph Uganda Mental Health Support and Recovery Program. And I'm also a person with psychosocial disability. This pandemic period hasn't been an easy one, I must say, for me, and also for other women with disabilities that I got to interact with. Just to give a brief on my experience, I remember going to the hospital last year in October to access sexual reproductive health services. And when I told the health workers that I do have a history of depression, their attitudes towards me changed, they became rude. But because I needed the medication, I had to stick around in order to see a consultant. So when I got to meet this gentleman, I had a lot of questions and I needed answers to them. But when I tried to ask, he instead told me from his view that I should do this, I do that, and I didn't even get to ask the questions, and so I also didn't get the answers. And then as he was still attending to me, his colleagues came into the room and they began to have a conversation, and it got me thinking, okay, I am here on the bed half naked, you're having a conversation, so I don't have any privacy at all. I felt all that the respect that I had been lost, the dignity too had also been lost, and all I could think of is get out of this hospital, never come back, or even go to any other hospital for these services because this is how they will treat me all over again. And so I got to talk to the organization that I'm in and decided to see how to reach out to these health workers and sensitize them and inform them that women with disabilities are not less of human beings. We are all equal and we deserve to be treated equally, given the equal treatment. And also interacting with these women that have disabilities, we decided that it's important we know our rights, and also as we go to these health facilities, we shouldn't let them treat us unequally, but with the rights that we do have, they should treat us like any other normal human being. And I also noticed this, that most of the women with disabilities were facing an issue of gender-based violence because of this of the current situation that you're in. Some people are willing to abuse you, to make you do a lot of heavy loaded work, which is not right. And in order for women to know their rights, it's important for us to continue advocating. Yes, the pandemic is with us. We're not so sure when it will go, but just as how life has moved on, and so does advocacy. So it's really hard to reach women, especially those in the rural areas, because they do not have this information, and it's very key and vital. But then we are told by the Ministry of Health to stay home, maintain the SOPs, which is really stressing. And so because of this, we are limited to reach the number of people that would want to reach out this information to communicate to them and educate them and sensitize them on their rights. And it's a bit difficult, but we are trying our best. Yes, also the funds are not enough, the inadequate funds, but at least still last year in December I was able to present a policy paper on the access to sexual reproductive health rights for adolescent girls and young women with psychosocial disability, which was very informative because people came in to support, to see how they could help us in order to see that women with disabilities can easily access these health services without any difficulty. And it was one of those moments that I really felt so proud of advocacy and has pushed me to continue advocating for the rights of women with disabilities. In conclusion, I hope and pray that we shall reach a time whereby we have a country, a worldwide peace whereby there is not inclusion for a specific type of people but for everyone. Yes, thank you very much for listening in. I remain Suubi Esther Deborah.